we'll all be demonstrating catheter care on a female resident with hand washing. Hi, Mrs. Smith. My name is Katie. I'll be your CNA today. I'm here to help with some catheter care. Go ahead and sanitize my hands. I'm going to check your ID. We'll go ahead and pull your privacy curtain. And then I'm going to go ahead and gather my equipment, Mrs. Smith. There's some privacy. Mrs. Smith, I hope you're having a good day today. All right, Mrs. Smith, I'm going to go ahead and get some comfortably warm water for you. All right, Mrs. Smith, I'm just going to have you test this for me real quick. Make sure it's nice and warm for you. All right, how is that, Mrs. Smith? Good? All right. I'm going to go ahead and put your bed up. We'll go ahead and get my gloves on here in a second, and then we'll get going on getting you all cleaned up. All right, Mrs. Smith, I'm just gonna get my gloves on, and then we'll get the bath blanket over you for some privacy. Just gonna gently bring the bath blanket, or excuse me, the sheet down to the bottom of the bed here. We're gonna keep your feet covered though, just to give you some extra warmth and privacy here. I'm going to gently pull up your gown in the bath blanket, and I'm going to place a towel underneath your leg there, just to keep everything nice and dry. And I'm going to grab my soap, and we're going to go ahead and get you nice and clean here. We're going to use the four-corner technique. We're going to put soap on all four corners. All right, Mrs. Smith, I'm going to go ahead and pull this up here. And what we're going to do is I'm just going to start cleaning your catheter, all right? I'm going to hold the catheter right where it inserts the body here, and pretend the catheter has four sides and I have four corners on my washcloth. I'm going to start furthest away from you, going all the way down, closest to the body to away, a minimum of 3 to 4 inches. Always holding. Do our final one here all the way down, making sure we're not pulling or tugging. It's going to go in the hamper, and now we're going to go ahead and rinse using the same technique here, Mrs. Smith. All right, I'm just going to go ahead and pull the bath blanket up for a second. I'm going to hold the catheter where it inserts the body, clean closest to the body away. For a second here, Mrs. Smith. Put that in the hamper. Then I'm going to go ahead and hold once again where the catheter inserts the body and dry closest to furthest away one time. That's going to go in the hamper. I'll pull your gown back down there, Mrs. Smith. I'm going to take this bath blanket off, put it in our hamper. We're going to go into the sink. I'm going to empty the basin here. I'll be right back. It's right next to you here, Mrs. Smith. We're going to rinse the basin out. We're going to dry it. Put it back where it belongs. This in the hamper. I'm going to take off my gloves. Those in the trash. Sanitize my hands. All right, Mrs. Smith, are you comfortable? Great. I'm going to go ahead and put your call light directly in your hand. I'm going to put your belongings within reach here. Would you like your privacy curtain open or closed? Perfect. I'll get that closed up for you here. Once again, if you need anything else at all, please don't hesitate to reach. It's just a little bit lower so you can reach everything, okay? All right, we have your bed in a nice safe position. I'll get your curtain situated here. All right, Mrs. Smith, I'm just going to go and wash my hands. If you need anything, just hit that call light for us. We go ahead and turn on the water. with some soap. We're gonna wash our hands for a minimum of 20 seconds. And I'm finished.